Frequency Podcast Network. Stories that matter, podcasts that resonate.
The tragedy of the overdose crisis can feel relentless. It seems like the numbers just keep climbing year after year. More lives lost, nothing working. Not to mention, of course, the politicization of various approaches to this problem, from harm reduction to treatment and recovery to safe supply, and all the bad faith arguments that are tossed around with them. Every so often, though, a ray of light shines through, and perhaps this one can help not only save lives, but also demonstrate the success of a nuanced approach, even if that approach isn't being advertised. Opioid overdose deaths have fallen 55% year over year in Alberta. That is a huge drop. It's also the continuation of a trend. So what's working? Well, if you were to ask a staunch conservative, it's the United Conservative Party's relentless focus on treatment and recovery, compared to the harm reduction and safe supply methods used in other provinces. But here's the thing. The UCP is also funding harm reduction. It just doesn't want to talk about it. So is this dual approach to blame for the decline? Is it something else? Whatever it is, it's something that's working. And if the government doesn't want to fully explain why, maybe we can help do that. I'm Jordan Heath-Rawlings. This is The Big Story. Dr. Monty Ghosh is an internist and addiction specialist, as well as an assistant professor at the University of Calgary and the University of Alberta. Hello, Dr. Ghosh.
Thanks for having me here. I appreciate it.
You're very welcome. And we've devoted a lot of coverage to the opioid crisis, most of it in BC. So maybe you could, for context, give our listeners a sense of what the numbers have been like in Alberta in recent years and how it had been trending.
Absolutely. So Alberta is not too different than BC, to be honest with you, in some respects. To start off with, a lot of our drug supply back in 2016, especially going onwards and towards the COVID pandemic, was coming from BC. So we were seeing parallels in terms of what was happening with BC in Alberta as well. But things have started to shift more in recent years because of the drug supply itself being changed and shifted and new organizations controlling the drug supply. But part of it's also because of the policy that Alberta has taken with the drug poisoning crisis in comparison to the British Columbia government.
And that's what we wanted to talk to you about today. But I also understand that the most recent set of numbers were pretty stark. Do you want to explain what you saw?
Yeah. So during the sort of beginning of the pandemic, as well as to the height of the pandemic for the drug poisoning crisis, we were seeing about upwards of 6 deaths a day in Alberta. And this is far more than car accidents, homicides, and heart attacks combined. So significant numbers. But the last few months, we've seen a drop in the number of overdose deaths or drug poisoning events towards the rate of about 2 deaths a day. Still very high, still alarming, but much less than we were seeing before. And this is in keeping with numbers that we've seen before the pandemic. Prior to the pandemic, we were again 2 deaths a day, but we never reached those levels until the last couple months.
Can you point to something or some things that have changed? Like, what do you attribute that to?
It's incredibly difficult, Jordan, to pinpoint exactly what has caused this shift to happen.
Right.
And we know that with most of these big crises, social, political, health issues that are facing these populations, that it's multifactorial in nature. And so one of the things that we can see is the drug supply itself is shifting. During the pandemic itself, we noticed that there was changes in the drug supply because it was difficult to bring drugs into Canada because of restrictions, shipping issues. And for that reason, we're seeing a lot more potent drugs and a lot of more admixtures, if you may, of what was going on in the drug supply. Mm-hmm. So before, it was just heroin prior to 2012. What we were seeing was that was being replaced by fentanyl, which is 50 to 100 times more potent than heroin, easier to manufacture, easier to ship into the country. With a small, tiny vial of fentanyl, you could get about 1,000 equivalent hits of heroin. So From an economics perspective, it's much cheaper to have fentanyl in the country. During the pandemic, we were seeing a shift towards carfentanil in some areas. We're also seeing a shift towards having mixtures with benzodiazepines and an animal tranquilizer known as xylazine into the mixture as well. But what we're also noticing in Alberta is that drug supply was different in different jurisdictions. And this is partly because of organized crime rings, who is in control of the drug supply in certain areas, in certain jurisdictions, which also impacted the overdose deaths. So for example, in Edmonton, we were seeing a large amount of carfentanil, and that had dropped, and I'm just giving rough numbers here, from 30% down to 15% from last year to this year in terms of the number of deaths associated with carfentanil.
Right.
In Calgary, we were seeing no carfentanil in our drug supply, with the exception of last summer for a tiny bit. So again, there's differences in different jurisdictions with the drug supply. It's different than what's going on in BC right now in terms of their drug supply. And it's very hard to say exactly what is in their drug supply versus what's going on in our drug supply. And, we tend to clump things as province by province, but really it's much more intricate than just that. It's Lethbridge versus Red Deer versus Edmonton versus Calgary. It shifts from place to place.
Right.
Now, the other thing that we've seen as a shift in Alberta is the importance of dealing with the drug poisoning crisis. And a lot of that is because of a gentleman named Marshall Smith, who is well known within the UCP government and is now part of Danielle Smith's inner circle. He's her chief of staff. But when he entered the province, he was a person with lived experience, and he tried to prioritize the substance use crisis and addictions in general as a need to be addressed, a need to be heavily funded. And that was not necessarily the case with Alberta. We've always had conservative governments, minus the NDP that was there for a short period of time. But I would say outside of the NDP, there wasn't really a focus on substance use and addictions. It was not treated as a health issue. It was treated as maybe a justice issue. It wasn't really looked upon as something of importance.
Right.
And with him coming into play, that shifted drastically. We saw more funding coming into the treatment of addictions and substance use concerns than we've ever did before.
I want to actually ask you about that because, as I mentioned off the top, BC has had a number of programs that have focused on harm reduction. Obviously, decriminalization efforts have received a lot of coverage, including from us. Can you maybe compare and contrast the policy approaches that we're seeing in the two different provinces and what the Alberta government has focused on?
The big line that Alberta is touting is recovery and the recovery-oriented systems of care, or ROSC, as it's also known. This philosophy, I would say, has evolved over time, over the last 6 years that the UCP has been in power. But the gist of it is that everyone should be moving towards recovery, almost all cessation of illicit substance use if possible. But it doesn't necessarily state that abstinence is an absolute must and that harm reduction is not a part of the equation. And this is where it gets a bit confusing because we will often get mixed messaging from the UCP party around this particular issue. You'll see the UCP party voting against harm reduction facilities such as supervised consumption sites. You'll see them talk about how these sites are not necessary. You'll see them create a panel evaluating supervised consumption sites, which was a promise that Jason Kenney's government had made back when he was around. Yet they've increased funding towards these harm reduction sites by 5 times. Although they have shut down one site in Lethbridge and replaced it with a mobile trailer, they have tried to increase the number of sites overall. So for example, they've tried to increase this number of sites in Calgary by 2. They promised to shut down the Schumer site, but they opened up a site at the Drop-In Center and Alpha House sites. They have tried to create a site at Strathcona County in Edmonton. And unfortunately, we're seeing a lot of pushback from the communities now more so than the UCP, which is very, very interesting. But they are supporting harm reduction initiatives such as naloxone kit distribution, supervised consumption services, education around harm reduction, needle and sterile supply provision, which is not what other conservative governments across our country are doing necessarily. But the one red line that they will not cross is the concept of safe supply or prescribed alternatives, which is something that the BC government has been doing. Ontario has been doing as well.
Why do you think that people who aren't following the policy on this or who just aren't in Alberta and don't have any experience with it kind of assume that the Alberta government's approach is, is one way and BC's is another. Like, I had no idea coming into this conversation that there was an investment in harm reduction in Alberta. I thought this was totally a move away from that and just towards treatment and recovery.
So a lot of it does have to do with the UCP's mixed messaging that it sent out about harm reduction. Again, voting against it, yet increasing funding towards it. A lot of this mixed messaging, I should say, for the UCP government in particular, is to appease some of the far right-wing factions of their party. I mean, it is a big tent party in Alberta with right of center versus far right of center. But I think part of it is because of their heavy-handedness against the concept of safe supply. And for the listeners, this concept is about replacing the illicit drug supply, which is incredibly tainted, very, very unpredictable, with something that's a bit more predictable, such as prescribed or pharmaceutical grade heroin, fentanyl, etc., which is I would say less than of an experiment now because it's been a while, but something that has been tried in BC and Ontario. And there's some mixed success with this. I mean, we don't have enough robust studies around this, but some studies have demonstrated a reduction in hospitalizations, potential mortality benefit within a few weeks of being administered this safe supply / prescribed alternatives. But there's also the flip side of this, in which there's concerns about diversion. What diversion essentially means is that people actually aren't using their safer supply or safe supply, that they're selling it to others and using that money to support their own substance use issues.
Right.
And there's numerous factors associated with this as well as to why people are selling their potential safe supply. Because of that strict and staunch adversity towards safer supply, including creating a commission against safe supply, which they did have in the legislature, there's this concept that they are against everything harm reduction. And they don't properly advertise harm reduction either, to be honest with you. But behind the scenes, they are supporting it. They are increasing funding towards it. And ideally, they would expand upon it to fund more.
When it comes to treatment and recovery, as I think I mentioned to our producer when we had a conversation based on some feedback we got on how we cover this issue, it is one thing to advocate for it and another thing to make sure that it's accessible. This kind of program can be, time consuming and expensive. And what kind of concrete investments has or hasn't the UCP made in making sure that, if they're pushing people to treatment instead of safe supply, that they can actually get that treatment?
Absolutely. So one of the biggest things they've done is that they've pushed for easy access to opioid agonist treatments. And this includes methadone and buprenorphine. These medications are a mainstay of treating opioid use disorder. These are life-saving medications that everyone should have access to. So what they've done is they've provided a heavy investment into programs such as the virtual opioid dependency program, which is open 7 days a week, in which anyone in the province can call into a phone number, get access to opioid agonist treatments, and not just clients, but social workers, people in shelters who are dealing with clients who are vulnerable. Anybody can access this service and get these medications for their clients. On top of that, every emergency department in our province is able to prescribe buprenorphine / Suboxone, which is incredibly helpful for this population group as well. And there's a lot of advertising going on towards this as well. So when I walk down the street in Edmonton and in Calgary, there's billboards, there's displays, there's bus stands advertising the virtual opioid dependency program. They've also invested in some other harm reduction resources as well, education, the DOORS app, which is the Digital Overdose Response Service, which is a virtual supervised consumption service too. Again, another harm reduction strategy. A lot of advertising around this. What they've also done is they've provided access to Sublocade. So this is an injectable form of buprenorphine. Very, very expensive. It's upwards of $1,000 an injection. It's a once-a-month injection. This also helps protect people who are using fentanyl from overdosing. So if they have this in their system and they use fentanyl on top of that, there's less of a risk of them overdosing, having an overdose event. They've also increased access to treatment beds. So one of the early promises that this government had made was that they would increase capacity for medically supported treatment services in our province. By medically supported, I mean access to medications such as methadone and buprenorphine, but also other medications to treat alcohol use disorder, methamphetamine use disorder. There's limited medications for that, but there are some options. And so they've increased capacity to treat these individuals by almost 1,500 beds in the province. And they're moving towards long-term treatment as well. So they're building these 11 recovery communities, also known as therapeutic communities, in which individuals can enter treatment and stay in these facilities for up to a year. And this has been a request made by numerous clients that I've interacted with and numerous families who deal with these clients as well. And so it's important to be put in place. It's a heavy investment of almost 350 million. And it might take even more, but it's happening and it's important, but not necessarily at the cost of harm reduction, again, which is where the mixed messaging is coming in. And I think that we need to be a bit more transparent about.
Why do you think these forms of care on either side, be it safe supply, harm reduction, or treatment and recovery, have become so politicized that, to your point, the UCP would not want to advertise, I guess, the fact that it's also doing harm reduction?
Incredibly good question, Jordan. I'm not too sure, to be honest with you, as to why it's so politicized. The key here is to follow evidence-based medicine, follow the data, follow the research. Supervised consumption sites do work. We need to be relaying that to the population, despite the stigma that they might have. For example, growing up in the 80s and 90s, we all watched advertisements saying that drugs are bad, that it's a criminal offense. There was this whole mentality of the war on drugs issue. It was a moral failing. And we now know, after years and decades of studies and research, that this is actually a medical diagnosis. This is no different than diabetes or hypertension, that it's not a moral failing, that it's intrinsic changes to the brain chemistry of someone. And it needs to be treated as a health issue, not as a justice issue, not as a social issue necessarily. It's a very, very much a health issue, and it needs to be focused on this as a health issue. So in some respects, BC going towards decriminalization is an important idea, because why are we treating this as a criminal issue if it's the same as diabetes and hypertension? We're not charging someone with a criminal offense for going to 7-Eleven and getting a Slurpee if they have diabetes. I think the form of decriminalization is where there's a lot of mudslinging, if you may. So BC's taken on a very progressive approach that's very different than anywhere else in the world, in which they were allowing people to carry up to 2 grams of substance at any given point in time. Alberta, has looked at another model of decriminalization. They've talked about this. It's not as open or transparent, but they've looked at the Portugal model of decriminalization, which is a bit different. It's more along the lines of what we call diversion, another different than diversion of substances, but it's more about diverting people away from the criminal justice system towards the healthcare streams of things and the social service streams of things. And they're looking at that model more so. And there's tons of evidence for this in Portugal. They've done this for over 20 years. It was a conservative government in Portugal that initially installed it. And it's had mixed success. The success was really related to the amount of money that they've put into treatment services in Portugal. That's where the success was. And they've significantly defunded over the last years, down up to 16% of where it was before. And that's not adjusted for inflation. And Alberta has made it very clear that if they are going to be pursuing this brand of decriminalization, that they need to build the infrastructure first. This includes treatment beds, treatment facilities, access to opioid agonist treatments.
Last question then, just in terms of Alberta, what kind of numbers do you expect to see in the next set that you'll get? And what could be done to continue the momentum that you're seeing in the province right now?
So I think the numbers that we're seeing right now are the lowest we have seen in a while and will likely increase over the next little bit. And this is based off of some data we've seen from EMS callouts. We know that the number of EMS callouts, which is regularly updated, often mirrors what we see with overdose deaths. And it has trickled up over the summertime, which is what we see almost every summer. So I do think that we will see an uptick in the number of deaths that we're seeing, but it will not be to the same level that we've seen during the height of the pandemic. The numbers that we saw in the summer of 2023, which is quite high as well, it will trickle up, unfortunately, but hopefully we can bring it back down again. And I'm optimistic that if we continue to push for more supports for this population, that these numbers will continue to decrease. In regards to your second question, Jordan, what needs to be done to continue the momentum is that we need to have an everything, all the time, easy access, on-demand support for people who are using substances and people who have substance use concerns. So this includes access to treatment beds, access to detox facilities, but also access to opioid agonist treatments, harm reduction services such as supervised consumption sites, access to mental health supports, access to housing and income support. All of this is necessary. It's a very, very complex picture. When we manage addictions, we try to manage it through what we call a biological component, which includes medication management, a psychological component, which includes mental health supports, and last but not least, a social component, which includes access to housing, income support. And this sort of trifecta, if you may, of dealing with a crisis is really what we need to make sure that things get better. And ideally, that's what we will be doing in the future. And I think the Alberta brand of conservatism and its approach to addiction management and treatment is very unique. And I'm hoping that other conservative provinces across the country follow suit with what Alberta is doing. We're seeing that Saskatchewan and Ontario, for example, are far more right of center than what Alberta is doing. So they're not supporting supervised consumption services. Ontario, for example, is shutting down 10 out of 17 of their supervised consumption services, some in jurisdictions that have no other harm reduction supports. And also Saskatchewan as another instance in which they've stopped doing supervised consumption, but also they've stopped allowing for sterile supply distribution and are opting towards needle exchange programs, which is a much more archaic version of these types of services. So it's important that if they are trying to look at the Alberta model saying and touting the success of the Alberta model, that they actually appropriately follow the Alberta model. And I'm encouraging them to do this.
Monty, thank you so much for this.
Thank you for having me, Jordan. I hope that was helpful.
Dr. Monty Ghosh from the University of Calgary and the University of Alberta. That was The Big Story. For more, you can head to thebigstorypodcast.ca. You may remember the last time we did an episode on safe supply, we got some feedback asking why we'd never examined a recovery-first approach. So, to a couple of people who wrote in about that, I hope this answers your question. You were right. We should have looked into this, and the UCP's approach is fascinating, especially the messaging around it. You can find all of our episodes on the opioid crisis at thebigstorypodcast.ca, and if you want to send us some more feedback, you can send an email to hello@thebigstorypodcast.ca, or you can call us and leave a voicemail 416-935-5935. Huge thanks to so many of you who wrote in with great feedback about our new approach to In This Economy. We can't wait to do some more of that. The Big Story is available in every single podcast player, including Seeker. And if you'd like to hear it on your smart speaker, just ask it to play the Big Story podcast. Thanks for listening. I'm Jordan Heath Rawlings. We'll talk tomorrow.